Hello, everybody. Thank you for listening and joining in. We're going to be talking about HArmonyCa today. HArmonyCa is a new filler introduced by Allergan. It has a storied history already in countries such as Brazil, been available for many, many years. And some of the Brazilian dermatologists and plastic surgeons have done wonderful, wonderful work, and they've been training physicians and dermatologists around the world on their techniques that have now been in use for maybe 8 to 10 years, which is really exciting. It was then found in Europe and now last month in North America, in Canada, in the USA. Here at Kingsway Dermatology, we were invited to be one of the first to the launch and training of HArmonyCa use as a filler agent for restoration of the face and off-label in the body as well. HArmonyCa is a CaHA-based filler product, and CaHA is the short for calcium hydroxyapatite. They're microspheres that are a physical calcium phosphate component, so they are inert in the skin. And what that means is it doesn't cause a pro-inflammatory foreign body reaction situation in the body. The interesting thing about HArmonyCa is that it is suspended in an HA-based filler that we all know and love, hyaluronic acid. So hyaluronic acid is sort of the normal base filler ingredient, and it is constructed in a way that it can have a stiff, kind of a lifting, plumping function applied into the layers of the tissues, or it can be flexible and hydrating. So it comes in different states meant for different placements in the skin, which is why we should all be choosing a very expert injector, because we have the ability to take all of the different available filler substances and know exactly where to apply them in the skin. And where those applications are basically middle ground and surface, and then really surface. So we could have an HA that's known as a booster, for example, and a booster is a common word we use to describe maybe a non-cross-linked HA or a mildly cross-linked HA that is very superficially placed. One of the most exciting things about HArmonyCa is its ability to survive in a semi-permanent basis. And what this means is that we know it definitely breaks down over about 9 to 12 months. The calcium phosphate microsphere is an elemental substance. In this physical state of semi-permanent placement in the skin, it nestles in beside fibroblasts and mesenchymal stem cells, and there is a physical stimulation to produce new collagen and new elastin in the skin, which is really quite amazing. The CaHA molecule suspended in the HA filler then stays in place where it is put, which is also a very precise and detailed aspect of this filler in the right hands with expert injection. Because the filler is laid down mainly with a cannula, it is safe, it's comfortable, and it does provide then a lifting and structural component to mostly the lateral aspects of the face. So think about your fingers in a C and going to the side of the face, causing a lifting on the high cheekbone or zygoma, the lateral aspects of the face in here to get some tightness and tautness to the skin, and then down along the jawline. So in the C shape like this, it can provide structure and lift and an amazing quality of the skin over 6 to 9 to 12 months time. So there is rebuilding and remodeling in this immediate and slow performing function. And the results are outstanding. So not only do we see collagen production stimulated deeper down into the subcutaneous plane, but we also see it into the skin surface through the dermis and actually into the upper dermis as well. So better skin quality and resilience overall. We've seen amazing results with the HArmonyCa in use at the clinic already. And I would invite you to come in and have a consultation and try the HArmonyCa filler. We are thrilled with the use and we're loving it. So one of our most popular videos to date was the Radiesse versus Sculptra video, and you can check it out in the links below. Let's just expand on that a little bit. What is the difference now between HArmonyCa, Radiesse, and Sculptra? So Radiesse is a CaHA-based filler, and it has a high concentration of CaHA in a mixed medium gel. The new HArmonyCa is a slightly less dense CaHA, but it is suspended in an HA filler. The Sculptra is a small molecule of about 20 to 35 micron uneven PLLA molecule, where generally it is suspended in a saline or water solution, and your injector might choose different suspensions and dilutions depending on the area injected. But the PLLA molecule has a foreign body type presence in the skin and in the tissues, and therefore it generates a reactionary pro-inflammatory collagen producing response. So that is the major difference between those three filler molecules. So two have a physical presence, they're inert, and it is a physical stimulation of the fibroblasts, and then the other is a foreign body response to the skin. So all three do produce new collagen and remodeling in the skin, and they do have different rules. They are used in deep planes in the cheeks, superficial subcutaneous planes in the face, and off-label in subcutaneous planes in the, get this, neck, décolleté, upper arms, back of the hands, upper knees, and buttocks. So if you have a problem area, there is definitely a biostimulatory filler out there for you. You might be wondering, can these all be used together individually, in combination, and with your regular HA filler? And the simple answer is yes, they can. Our strategy at Kingsway Dermatology is to provide a long-term plan that involves injecting our fillers, watching the tissues remodel and respond to what is already injected as a base, and then providing extra layers and extra filler upon review and reassessment, and creating a plan in that manner. We do know that there is some filler fatigue, filler fear, filler scare out there, but we do know that filler injections by far and wide are still very, very safe, technique dependent, anatomically dependent, in the right hands and the right provider are a very safe way to proceed. We like to think of fillers such as HArmonyCa or Sculptra or Radiesse or dermal fillers such as the HA fillers as tools in the toolbox. They all have a role, and in the hands of an expert injector with the right expertise, such as at Kingsway Dermatology, when you come in, we can provide you with the plan to start. So we will pick from our toolbox, and it's probably gonna involve a little bit of surface collagen stim with a procedure, which is very, very important as well, to provide the best outcomes. So I hope that provides a little bit of knowledge and background and education for you on our new injectable called HArmonyCa. If you have any questions or comments, please feel free to drop them in the comment section below. Thank you for watching. See you later.